Hello, friends. Hi. I am so excited to be here following Senator Casey's remarks and giving the keynote address at the 2021 PA Nursing Summit. Thank you, PA Needs Nurses Now, for inviting me and for the amazing work that you do. I am honored to speak with you, and I'm thrilled to be part of such a wonderful community. I am Elena Hung, better known to some of you as Xiomara's mom. I'm also the co founder and executive director of Little Lobbyists, a family led group advocating for children with complex medical needs and disabilities. As I reflect on the past several years, I am feeling more energized and hopeful than I have felt in a really, really long time. Allow me to share a bit of my journey with you leading up to this moment. In many ways, my healthcare advocacy story began in early 2017. Like so many across the country, I was watching the news about the Republican healthcare repeal efforts then, and I got really scared and worried and angry. And in a moment of hope and desperation, my friends and I showed up on Capitol Hill one day to tell our healthcare stories. My daughter Xiomara and I, and other families with children with complex medical needs and disabilities, wanted to put a face on healthcare, wanted to put a face on those who were alive because of the Affordable Care Act and Medicaid. So we collected stories, healthcare stories, from families like ours from across the country, and we hand delivered them to members of Congress. We had planned on just one lobby day, but that one day quickly led to another and another, and Little Lobbyist was quickly born. In the weeks and months, and yes, years that followed, my friends and I, we showed up. We kept showing up on Capitol Hill. We showed up at every rally and press conference that we could get to, both in DC and across the country. We grabbed every mic that we could get our hands on. We talked to every staffer and member of Congress that we could chase down. We spoke to the media. We wrote op-eds. We even learned how to use Twitter. We wanted everyone to hear our stories. So here is my story. 7 years ago, I had a great pregnancy and an amazing birth. And then 15 minutes after my baby was born, she was placed on 100% oxygen support and rushed to the neonatal intensive care unit, where she remained for the next 5 months. She was diagnosed with serious medical conditions affecting her airway, her lungs, her heart, her kidneys. I named my baby Xiomara, which means ready for battle. She is definitely that, and she is the joy of my life. I am so lucky that I get to be her mom. Now, Xiomara uses a tracheostomy to breathe and a ventilator for additional respiratory support, a feeding tube for all of her nutrition, and a wheelchair to get around and explore the world around her. I am thrilled to tell you that Xiomara is thriving today. She is happy, kind, funny, clever, and a little bit naughty. Xiomara recently graduated from the first grade, attending school via distance learning. She celebrated her 7th birthday this summer. Wow. These are two milestones that were never guaranteed to us and that I am forever grateful for. And I'm so grateful for our access to affordable quality health care, including Medicaid. Because it was Medicaid that paid for the home skilled nursing that enables Xiomara to live at home with her family instead of an institution far, far away. And because of that, she's had the opportunity to grow up with her big brother, tons of friends from the neighborhood, and a community that loves her. I won't pretend it was easy. Xiomara was not sick enough to be inpatient at a hospital or facility, but she was sick enough to require an awake and alert, skilled caregiver round the clock. That's 24 hours a day. Someone who was trained in tracheostomy care and who knew what to do in case of an emergency. And in this case, an emergency meant life or death in a matter of minutes. Her room at home was filled with equal parts medical equipment, medical supplies, and baby toys and stuffed animals. There are lots of unfilled nursing shifts that left Xiomara's dad and I pulling overnight duty night after night, day after day. There were nurses who were not properly trained. It was hard. But my family is lucky. We survived those early days and Xiomara thrived. And this gratitude makes me think about power and representation. I think about the stories that get told and who gets to tell them. And I think a lot about what Congresswoman Ayanna Pressley says. Those closest to the pain should be the closest to the power. I'm going to say that again because I just love it so much. Those closest to the pain should be the closest to the power. Now, no movement for social justice has ever succeeded without the full participation and leadership of those most directly affected. And that is certainly true for the health justice movement. That is power. So friends, own your power. If you are ever feeling powerless, remember that your voice is your power. Use your voice. Tell your story. Sometimes using your voice means being loud and persistent. Sometimes it means getting on the red line and taking the metro to Capitol Hill to speak with your senator for the very first time. Sometimes it means knowing your story will put a face on policy. So you get up on stage to take the mic, or make a phone call, or write an op-ed, or have that difficult conversation with a family member or neighbor, even though you're nervous and scared. Sometimes using your voice and using your power means passing the mic to center the voices of those most directly affected. It means elevating the voices of those who have been historically and consistently left out of the conversation and the decisions that affect them. My advocacy has been informed by my daughter and is centered on the disability community. There is not a single issue, whether it be healthcare, immigration, climate change, criminal justice, gun violence, education, employment, voting, not a single issue that does not impact the 1 in 5 Americans that live with a disability. At the core of everything I do and believe is that we are only true advocates if we engage in inclusive advocacy. So when I advocate for healthcare for those with complex medical needs and disabilities like my daughter Xiomara and her little lobbyist friends, that includes immigrants with disabilities, LGBTQ people with disabilities, people of color with disabilities, people of all faiths with disabilities, those living in poverty with disabilities. And that means all disabilities, whether it be mobility, sensory, mental health, intellectual, or developmental disabilities. It includes our friends with chronic health conditions, in recovery from substance abuse, and those living with trauma, because all means all. Using our power means uplifting and centering all of these disabled voices, however they define their disabilities, however they choose to communicate. As my friend Julia Bascom says, there is no such thing as the voiceless, only the unheard and the silenced. So let us all commit right now to using our power so that everyone is heard and no one is silenced, because representation matters. And that brings me to impact. How do we define impact? Well, I tell you what, together we saved the ACA. Together we saved Medicaid. We did that. The impact is collective. The impact is personal, deeply personal. My daughter Xiomara relies on Medicaid, and what that means is that she gets the life-saving care she needs. It also means that she gets to grow up at home with her family in a community that loves her. I'm not forced to ship her off to an institution far away, which is what routinely happened to disabled kids like her not that long ago. That's what Medicaid means to her. That's what Medicaid means to me and my family, and that is why we need more funding for home and community-based services, including skilled nursing at home, to achieve healthcare justice so kids like Xiomara can survive and thrive. We saved the ACA, and we are here now with an urgent mission to ensure that healthcare is indeed a human right to improve and expand to a universal healthcare system that works for everyone. Right now, we have a once in a generation opportunity to make a life changing investment in home and community based services and solidify that caregiving is an essential part of our infrastructure. That starts with a $400 billion investment in President Biden's American Jobs Plan so that our kids with complex medical needs and disabilities can thrive. This is a historic opportunity, and this can change and improve the lives of disabled people, and we must fight for it as hard as we have fought for anything. This is the time for states like Pennsylvania to use this national momentum to lead the way in creating a real caregiving infrastructure. That is impact. Impact is elected officials and members of Congress understanding our humanity and lived experiences alongside the data and numbers. Impact is a seat at the table where decisions are made. Power, impact, now. Now. The time is now. The time is always now. We have so much work to do and we need to keep going. We did not come this far to stop now. We didn't start to stop. Time is now. I know that we've had some really scary times. We witnessed the fragility of our democracy. At the start of this year, we witnessed a violent racist coup attempt in our beautiful capital, a building so many of us have fallen in love with during our lobby visits to Washington, D.C. We witnessed our friends and families experience terror and trauma when the previous government relentlessly attacked our healthcare the past 4 years. We're still in a pandemic that is disproportionately affecting Black, Brown, Indigenous, and disabled communities. We are hurting and we are mourning. All of this is very real, and we're all coping in different ways. And through it all, we continue to advocate, we continue to speak up, we continue to tell our stories. And like many of you, I'm going to continue to do the work. Like you, I am attending events like the PA Nursing Summit. Like you, I'm having energizing conversations with colleagues in other organizations, and I'm having hard conversations with elected leadership. Now, I'm going to work hard because the work is important and urgent. But I'm also going to play hard and find joy wherever I can. Now, I'm going to laugh and dance and love and have fun. So I'm going to leave you with this. While there will always be dark days, and there will always be a few who try to destroy what we hold sacred, there are many more of us who are trying to create a world where there is justice and equity. There are way more of us trying to create a world where we can be joyful. And if we're working on the latter, but deny ourselves the joy in the process, then we're missing the whole point of all this. If we're fighting for our kids to survive, but not thrive, then we're missing the whole point of all this. We can do both. We can survive and thrive. We can work hard and play hard. We can advocate for comprehensive funding for home and community-based services, and we can enjoy quality time with our loved ones in our homes and in our communities. So friends, go on and find joy. Create joy if you must. Give yourselves permission to feel joy. Now, because joy is an act of resistance. It is. It has been an honor to share my words with you and to fight alongside you. Thank you. Thank you all for your time today. Thank you for the powerful work that you do. Thank you for the impact that you make. And thank you for the joy that you bring. Thanks, everyone. Be well.